Hello, I'm Dr. John Cruz, and today I'm going to be talking about brain fog or sweeping away brain fog, what we can do about it. I'll be open to questions at the end of this time, and hopefully I'll plan on talking about 20 minutes or so. And starting with my take-home message. So brain fog is not a precisely defined condition. It's more a colloquial term, although it's used in several hundred papers in the research world. So poorly defined condition involving some either acute or chronic impairment of largely executive functions and some subjective feeling of fuzziness or cloudedness or fogginess. Again, it's associated with a host of different conditions, and there are numerous studies specifically looking at brain fog, and by and large, there's a huge overlap between treatments for ADHD and treatments for brain fog, all of which have at least some small amount of published studies suggesting they can be helpful. So that includes, again, both medications that are used for ADHD, stimulants, and others that have been used in the setting of brain fog, and some of the non-medication approaches, including exercise, as we talked about last week, bright lights, and relaxation approaches. So, despite not having any precise medical definition, brain fog is usually taken to include a range of mental health or mental conditions, mental symptoms. Again, many of them overlap strongly with ADHD. So troubles focusing, trouble sustaining attention, troubles with immediate word recall of words, finding words, short-term memory issues, fatigue, both feeling physically and mentally fatigued and feeling that any thoughts are requiring a great deal of cognitive effort, troubles multitasking, so feeling overwhelmed when asked to do multitasks, and at least one domain that isn't a classic ADHD symptom, not that it can't be there, is again, at least some amount of dissociation, feeling either I'm sort of not in touch with my own body, or I'm not in touch with reality, or some feeling subjectively that things are fuzzy, cloudy, not as sharp, not as real, not as alive as I can be. So brain fog has been associated with a number of different neuropsychiatric and physical conditions. Again, ADHD is probably the one with the most extensive amount of overlap, but most of the people who write about it actually list depression and anxiety ahead of ADHD or don't even mention ADHD. So people who are depressed, again, not invariably have brain fog, but often have this host of symptoms. People with anxiety can as well. There's a considerable overlap with dementia, and particularly there may be time of day issues with dementia, so particularly the sundowning phenomena or confusion at the end of the day, and confusion, fatigue, again, dissociation, cloudiness, confusion might be there. Brain fog is also a common symptom of chronic fatigue, which we also call myalgic encephalomyelitis condition or disease. It's one of the most frequently cited symptoms of traumatic brain injury. It's there with a host of infectious diseases post-infection, and most notably post-COVID. So some studies suggest as many as 10% of people 3 months after having COVID infection are having some degree or some amount of brain fog symptoms. And for those who have the full long COVID syndrome, this is one of the most common complaints and one that affects functioning. A host of autoimmune conditions such as lupus and multiple sclerosis, brain fog is a common part of them. Sleep deprivation, so just staying, pulling all-nighter, or chronic sleep deprivation or sleep restriction where you're getting less sleep than your brain needs. this is a common complaint, that you're not feeling fuzz or not feeling clear-headed, having, again, impairments in all these executive functions. And chemotherapy, so cancer treatments, which we're giving poisons that kill quickly replicating cells. A fairly common side effect of either radiation or chemotherapy for use in oncology is to create a brain fog scenario. So those are the conditions it's associated with getting a little more in the direction of what's actually going on. Many of the researchers sort of break it down into categories of what are causative roles. So they lump some of these things together. So far and away, the most common cited causative role is some degree of neuroinflammation. So some of these causative pathways certainly overlap with each other. They're not mutually exclusive. But neuroinflammation, so mild inflammation in the brain, not necessarily a huge raging immune response, but more than is normal, showing low-grade chronic inflammation is one of the most strongly implicated factors in brain fog. Before I jump back to the other causes, I'll back up a little bit and say that all of these brain functions, all these executive functions that are impaired with brain fog seem to be frontal lobe. So we do have them somewhat localized to what part of the brain. And the thoughts are that there are certain aspects, both energetically and neurotransmitter-wise, that might make that part of the brain particularly susceptible to different factors. So neuroinflammation is one sort of causative role. Again, the fact that several autoimmune conditions are associated with brain fog, but also the fact that for many of those people who have post-COVID neurofog symptoms, there's no evidence, or when they've specifically looked, that the virus was actually in the brain. So it's not tied or correlated with viral particles invading the brain and or damage from viral particles. It seems to be a more indirect, and the time course also is that it tends to be a delayed aspect of COVID infection or of post-COVID, long COVID conditions. So toxins in either within brain cells or around brain cells accumulating. And again, that evidence for that comes from the chemotherapy, where you're introducing a direct toxin into cells. Also, the fact that sleep deprivation, the brain clearing or garbage clearing system of the brain operates only at night and only so it's when you're sleeping and at night. So it's both a circadian rhythm and a sleep connected effect. And the result of not flushing out toxins from your brain, either intracellular toxins or intercellular, either within the cell or between neurons, may well be a contributor to brain fog. There's also been a lot of interest in research on energetic principles, and that particularly brain uses about a fifth of the body's energy, glucose and oxygen reserves, even though it's only compromising about 2% of the brain and the body's mass. So it's a high energy, high metabolic part of this. And particularly the forebrain is one of the more active sites energetically. So one other sort of causative roles, it may well be some of it's tied to what we were talking about last week with bright lights and how desynchrony within the brain. So if different systems of different components of the brain aren't working in synchrony with other groups of nerve cells, then thoughts are disrupted, there's confusion, there's dysfunction. Again, even though that individual cell may be doing everything it's supposed to be doing, if it's not syncing with its buddies, then the output of the whole system is going to be disrupted. So particularly with the immunoinflammatory neuroinflammation effect, There's certain cytokines. So cytokines are chemicals produced by immune system cells. So interleukins 1 and 6, tumor necrosis factor, if you inject them into healthy animals or even healthy humans, seem to be likely to trigger some amount of brain fog-like symptoms. These are chemicals that trigger and invite other immune system chemicals to invade the brain. They cause dysfunction, primarily of glial cells, the supporting cells around the neurons. They can cause decrease in neurogenesis. So at least in the hippocampus, we think part of memory and part of emotional control are highly tied to the hippocampus, and new cells are being made there. Neuroinflammation seems to decrease that neurogenesis, and myelination, so the insulation covering the long axon sheets that make up the white matter of the brain, is impaired when there's chronic neuroinflammation. Combining with so the neuroinflammation can also have neurochemical effects, and some of them include overproduction of some excitatory neural pathways, and the the vulnerability of the forebrain, according to some researchers, is tied to the fact that the forebrain areas are particularly tied to excitatory neurochemicals that use NMDA receptors rather than AMPA receptors, and that neuroinflammation or other forms of stress can cause an opening of potassium. And in other areas of the brain, that may make cells communicate more strongly. In the forebrain, this actually weakens connectivity, and some researchers believe that's the main origin for brain fog. So what can be done about brain fog? So again, most of the things that have been studied are medications or non-medication approaches that have been used for ADHD. Foremost and most extensively are the stimulants, so things like Ritalin, Adderall, and often used judiciously in smaller amounts, do seem to be effective in some formal studies for treating brain fog. There's also studies, moving beyond Adderall and Ritalin to phentermine and other sort of non-traditional stimulants. There's also some published studies using Wellbutrin, Strattera, which is atomoxetine. So other agents, some of which have been FDA approved for ADHD and others not. Many of these are using or have a strong norepinephrine reuptake or a dopamine reuptake component, and that's again thought to alleviate brain fog. There has also been some experimentation with medications that both may have some stimulatory effect, but also may have some anti-inflammatory effects. So ketamine has some anti-inflammatory effects in the brain. There are studies using ketamine to treat brain fog. One of the more interesting studies done with a post-COVID brain fog picture used a combination of agents. So this is from a group that strongly believes that the emphasis on NMDA receptors rather than AMPA in the forebrain and the influx of or opening of calcium or potassium channels, the flux of calcium in the brain is the main reason for weakening connections and pathways and causing brain fog. They did an open trial, so not a controlled rigorous study, using a combination of guanfacine and N-acetylcysteine. And most of their subjects seem to have a considerable positive response to that. So the guanfacine is the same active ingredient as Intuniv. It is an alpha adrenergic agent, which indirectly promotes flow through of the norepinephrine system, but it also has some ability to disrupt the chain of chemical reactions that seem to be happening when there's neuroinflammation or psychological stress and perturbations in the brain, including dampening down some of the damage and some of the misguided activities that microglial cells get into when they're in a chronic neuroinflammatory stress. And the dosages of guanfacine used in there, again, it was only, I think, 8 patients I had that responded. It was 1 gram of guanfacine. It was 600 milligrams of N-acetylcysteine. Again, both of these agents have some actions dampening down the negative effects of neuroinflammatory processes in the brain. So other chemical agents that have been looked at is sort of a wide variety of non-prescription medications, including herbal preparations such as curcumin from turmeric and rhodiola. And outside of chemical medication approaches, there's been studies looking at pretty much every non-behavioral or non-medication approach that's been used in ADHD. So physical activity does seem to have some acute effect, benefit for most people in clearing away brain fog. So just 20 minutes of vigorous activity does seem to help clear the mind, clear the brain. Exposure to nature, so just getting outside rather than staying in front of your desk, staying in front of your computer processes. Exposure, again, to bright lights, which we talked about last week. So when I have patients complaining about brain fog, go taking a brisk walk outside, brings in the light, brings in the exercise, brings in the nature component. Again, there do seem to be brains grew up evolutionarily in nature. They seem to do better in that environment. And that includes, again, some evidence that can be helpful for some aspects of brain fog. The other important mention when I mentioned the light is, again, the light may have some direct effect, and part of its effect may well be synchronizing internal circadian rhythms, the 24-hour master clock. Again, the important thing about our waste disposal system in the brain, the glymphatic system, which was only discovered in the last decade, is that's a system that only works when you're sleeping, and it only works if you're sleeping at nighttime. So public service announcements for decades have told people, you need 8 hours, you need 8 hours, you need 8 hours. Most people know that. Most Americans aren't getting that. That clearly is deleterious for our brains. But again, it's not just the amount of sleep, it's getting it at the right time. So getting the same 8 hours at a different time of night is not nearly as restorative. Part of that, again, may be that we're not activating the glymphatic system and we're not flushing toxins out of the brain. So I don't have a lot more specifically, again, because partly this is a nebulous topic, poorly defined, lots of overlap with other conditions, but I hope this has been of some help. And next week, I'll be talking about genetic tests for ADHD. I've talked about that in a bigger context, but there's been enough requests and interest that I'll be talking about it again. I'm not seeing any questions come up. I'll probably stall for another 20 seconds or so to see if anyone has any questions. I'm happy to try to answer them, and you can just type them into the chat section. They don't necessarily need to be related to this topic. So thanks from the great artiste who voiced their appreciation. I'm glad this was some interest and or some help, and they appreciate how I connected phototherapy to this topic. So thanks. And hi to Omar, who just said hi. I will be back next week. And certainly if there is a better time or if there are specific topics you want me to talk about, you can type them in now, or you can send them, email me through this YouTube channel. Otherwise, have a healthy, happy week. And if you're watching basketball playoffs, get to them. Okay, I see a question from Omar. So Omar says he has ADHD and anxiety together. SSRIs helped anxiety a lot, but made my ADHD worse, and Ritalin useless. And Ritalin alone made my anxiety worse. So couple questions embedded there. One is it common to have comorbid conditions? And absolutely every study suggests that the majority of people with ADHD have at least one other condition, with the most common ones being our more common conditions, particularly depression and anxiety disorders. Substance abuse is more than twice as likely in the ADHD population. Some studies suggest at least 80 to 90% of people with ADHD have sleep disorders. OCD, which oftentimes we think of as the opposite of ADHD, not really, but in some ways there are diametrically opposed subsets of symptoms. Something like 15 to 30% of people with ADHD have clinically significant OCD. That's way higher than the general population. Increasingly, some of the evidence, particularly some of the genetic evidence, suggests that all of these conditions have a strong genetic influence, and almost always it's polygenic. So that means many genes are contributing each a tiny, tiny bit to your propensity. But many of these genes are creating a propensity for any, we'll say, psychiatric condition. Some of them there are subsets that are specific for schizophrenia, for ADHD, or bipolar, or depression, but most of them seem to be increasing your propensity to anything. So that's at one level, there's a common genetic basis. The secondary thing is that with something like ADHD, if you are blurting things out, if you're not tracking your own thoughts, if you're distracted, that can cause social problems. So that could cause, once you're aware that people are not responding to you the way you might want them to be, or perceive you differently than you're perceiving, that could contribute to something like social anxiety. If you have more failures by society standards, if you're not achieving commensurate with your intelligence and other skills because of ADHD symptoms, that could lead to, again, societally based or viewed failures, sadness, depression-like symptoms. There's a huge overlap, again, between ADHD and anxiety. So I hope I've answered that part of the question. The other aspect I was going to get back to is that stimulants in people without ADHD, their common side effect is to be people more anxious. And it's not that people with ADHD are immune to that effect. It's that you just usually need to go to a higher level for them to cause anxiety. And many people, and we saw this during COVID, we also saw it with Donald Trump's election or other distressing news, many people with ADHD who were on a stable dose of a stimulant, when external factors brought up the anxiety level, then needed to back down on their dose of stimulant. Otherwise, they would wind up too overactivated, too anxious. And particularly useful in that setting is the non-stimulant medication that's approved for ADHD, which is guanfacine. Again, it's an alpha-2 agonist, originally a blood pressure medication. Commonest side effects are that it's sedating, so it's usually used at nighttime. Also, unlike most of the other medications for ADHD, it works slowly, but many people who could not tolerate a stimulant, if they stop their stimulant, start over with guanfacine at a low level, and again, the guanfacine itself does directly help with ADD symptoms, but also one of its most common uses right now is that when a stimulant is reintroduced on top of guanfacine, many people can tolerate a stimulant that they weren't able to tolerate originally because of too much anxiety overactivation. So I hope that helped. And hello, Lorenz. And unless there's more questions, I'm going to be signing off again. If there's topics you want me to talk about, or if there's a better time to meet, you can email me or put them in a message, and I will be back next week. Stay healthy, stay happy, and I hope this is educational and interesting. Good night.